It's time for Back to Life, brought to you by Southwest Spine and Pain. A 30-minute conversation with their board-certified physicians about how to live life again, pain-free.
Welcome to Southwest Spine and Pain Back to Life show. Our host today for the next 25 minutes is Dr. Rick O'Bray. Welcome, Rick, Dr. Rick, and you're going to be discussing stem cell therapy today, and tell us a little bit about that and what aspects are important for the listeners to be aware of.
Yeah, perfect. Thanks, Dan. Thanks for having me. I think this is an increasingly popular topic that we get a lot of questions on through the course of the week and through taking care of patients. So, per request, we thought it would be a good idea to talk a little bit more about it. A couple of critical things to understand about stem cell technology and treatments is it's a relatively new field and it's developing very quickly. And as more evidence comes out almost every month, we learn more and more about the potential applications of this type of therapy. Currently at Southwest Spine and Pain, we do offer stem cell type therapies. And there are really three different types that we offer at this point. One is bone marrow aspirate stem cell therapy. This is probably the one that's been around the longest and has the most evidence for it. It's been done in France for about 10 years now, a little over that. And there's several studies that show that, particularly for musculoskeletal applications, primarily knees, shoulders, joints, that there has been some evidence that's been effective. So bone marrow aspirate therapy is one. Another is tissue allograft therapy related to birth products, such as umbilical cord products and placental products. So someone might think, well, that's a little crazy, right? Why would someone be injecting particularly umbilical cord products? Well, it turns out that the umbilical cord is the richest source of stem cells in the body. In the first 9 months of life particularly, those cells do some pretty amazing things, both in protecting the fetus and helping the developing fetus develop normally. So that is also a target, and there's some evidence coming out, more evidence all the time for that therapy. And then the third way you can get stem cells is through adipose tissue or fat tissue. Turns out that fat also has a relatively high concentration of stem cells, and that can be used for treatments. One of the things I think is critical to understand with any of these therapies is that the evidence is very early, and what we call level 1 evidence or double-blind randomized controlled trials are pretty limited in the United States right now. So it's important to understand that and what that means, and we can talk a little bit more about that as we go on.
Wonderful. As we talk about the three types of stem cell, maybe we could go in a little bit more detail. Maybe you could give an experience or one of your patients that has gone through this process. I know last time we went into the subject of a little bit of using it for therapy for in children who have challenges with, what was it?
Autism, yeah.
Autism, yes, with autism. So, I mean, can you give an example of one of the ones that you've worked on just recently, and what form of the three of these did you use?
Yeah, that's a great question. So in our clinics, we primarily focus on musculoskeletal conditions and spine conditions. However, there was a study recently, a phase 2 study recently from Duke University where they looked at treating kids with autism, which was pretty remarkable, some of the results. Now, again, that's a small phase 2 study. They're getting ready to launch the phase 3 study, which everyone's excited, especially in Utah where we have a high rate of incidence of autism along the spectrum. About 1 in 60 patients, 1 in 62 patients develop somewhere along the autistic spectrum, which is kind of everything from mild to severe. So we're watching that study closely. In our clinic, we focus again on musculoskeletal and spine conditions. So we treated hundreds of patients with stem cell type therapies, and we've seen success with just about all types of stem cell therapy. We participated in a national randomized double-blind control FDA-approved trial using stem cells to treat degenerative disc disease. That was pretty exciting. Those were cultured stem cells that were taken from bone marrow, grown, and then injected into patients' discs. And that's one we're watching very closely. Enrollment has completed for that study, and it should be published hopefully in the next 2 years. And that's one of the first randomized double-blind control studies, which we would consider level 1 evidence, assuming that's positive, and we'll see. We'll see what the results showed. In that study, I was with the primary investigator, principal investigator, and actually was blinded. So I didn't know if the patients were receiving stem cells or a placebo, and the patients didn't know if they were receiving stem cells or the placebo. So that's one we're watching very closely. As far as patients we treated, Had a lot of success treating patients with knee pain, osteoarthritis, degenerative disc and spine conditions, as well as other joint pain. The fingers of the hand for kind of severe, moderate to severe osteoarthritis of the joints, we've seen some success with, which is exciting. Part of the reasons we got involved with stem cell therapy is, we've treated, I've probably done between 20 and 30,000 procedures on patients, and treat a lot of patients that have had previous surgery, whether it's joint replacement surgery or spine surgery. And unfortunately, we're not able to help everybody. There are a certain percentage of patients that just don't respond to normal treatments. We are in the midst of a medication crisis a little bit right now with opiate pain medications. So we're constantly looking for therapies that expand what we're able to do for patients and try to get them better and improving in their condition. We've talked many times about pain and how debilitating that can be for patients. So one of the reasons we're interested in these new technology, and stem cell being one of them, is to try to increase what we can offer patients to try to help them improve and not suffer on a daily basis like many of our patients do.
That's pretty amazing how it's grown so exponentially, that area of the tissue, of the different forms of stem cell research. And thank you. And with that in mind, I just wanted to mention that we're going to open the airwaves so that for people that want to call in, they're welcome to, and we'll take calls as we're talking. How does that sound?
That sounds great.
Rick?
Yeah, that'd be great.
Okay. You mentioned your father has a debilitating condition. Are you able to do anything in that respect yet? Is this something that you're working on right now? And I know you mentioned that you might be doing some research or taking him somewhere with a specialist.
Yeah, one of the things we watch, and I obviously watch literature very closely in the use of stem cells as it's rapidly expanding. My father suffered from multiple sclerosis for a long time. And, I was a very small child. I remember him going through that process, and then he's still with us, fortunately, and doing well. But the effect of chronic illness on him had a major effect on him and obviously our family. There was a recent study that came out using stem cells, an IV infusion, which is not available in the United States, but it was available in Panama, where patients that had multiple sclerosis were able to reduce their recurrence rate over a 2-year period from 60% to 6% compared to placebo. So I was in Panama about 4 or 5 weeks ago now, speaking with a physician down there who was involved in some of those studies, which was very interesting. Again, those are small studies. That's not level 1 evidence, but it's very encouraging and optimistic as a potential treatment. One of the things that's so interesting about this new technology, it's going to affect almost all aspects of medicine. I mean, stem cells are being used to treat a host of different conditions, and as the evidence gets better, our understanding of how to use this technology will get better and better.
And with that in mind, could you go into a little bit more detail about the umbilical procedure, where you mentioned that has the richest cells? Or is that? And I remember you mentioned at some time that a lot of the people now are really encouraged because it used to be very expensive to store those, and now the cost of that has gone down.
Yeah, I think that's something it's important to consider. So the interesting thing about that Duke autism study was that it was only available to children who had their cord blood saved at birth. So they were able to take that cord blood that they'd saved at birth, they cultured the cells to high numbers of cells, and then they infused those back into those kids. So now, historically, cost of cord blood storage has been as much as $3,000 to $5,000 to do that. Those prices have come down pretty significantly, and especially with this autism study coming out, I do think it's worth looking into cord blood storage and stem cell storage from the umbilical cord, because I think there will be a host of therapies coming in the future where if those cells are saved, they can be used for therapy for not only the child that used that umbilical cord, but also family members as well.
Even the parents.
Potentially, because the closest matches will be with the parents and the siblings, obviously.
And then as we talk about the antipus, the fat tissue, is that the one that's used more frequently right now?
I would say the most frequently used right now is going to be bone marrow.
Okay.
Now, that's a little bit more difficult to do because it requires a surgical procedure and it requires someone who really knows what they're doing. Otherwise, that can be it's a little bit more involved than either an adipose tissue injection or an umbilical or placental tissue injection. So, but adipose is basically an outpatient procedure where you take adipose tissue, fat tissue, and then it's minimal processing, and that can be injected, similar to a bone marrow procedure where it's someone else's cells. And that's an important point to consider. So a bone marrow aspirate procedure is where we take bone marrow from the person who's being treated, and then we can redistribute that bone marrow, and particularly the stem cells in that marrow. So the source of the cells is the patient. That's the same for adipose tissue. The source of the adipose or the fat tissue is the patient. Tissue. Yep. Now, it's different for umbilical cord and placental tissue products. Those are healthy moms, healthy births. So mom is screened, baby is healthy, born. They take the afterbirth after they've, demonstrated the baby's healthy. They minimally process that afterbirth, and that is then tested for all known viruses, bacterial contamination, all of those things. And that's all per the FDA and American Association of Tissue Bank guidelines. Similar if you're doing a knee, ACL donation or any bone for a spine surgery donation, same criteria. And then assuming that tissue is found to be safe, as much as they can prove that it's safe, then it can be used for injections. And that's generally what you're seeing when you hear about umbilical or placental tissue. Now, the tricky thing I will say about that is, now the FDA and the AATB, American Association of Tissue Banks, requires pretty rigorous screening for all those afterbirth products. Now, that doesn't mean that every company out there that's quote-unquote selling these placental and tissue products is actually going through that process. So anyone who's considering these types of procedures, one, I'd recommend you talk to your treating physician, whether it's your primary care doctor or whoever you're talking with, because they may have valuable insight. But two, it's important that you understand where the physician or whoever is doing the injection is getting those products from. Because, I've done consulting work for several national stem cell companies, and I've traveled around looking at a lot of different types of companies that are in this space, and I saw dramatic variation in both the quality of the companies and the sterility of the companies that were performing this processing of afterbirth products. And I kid you not, at one place I saw a company that was processing stem cells in a warehouse next to a motorcycle. So it's important that patients understand what they're getting and that the appropriate precautions are being made to protect them. How
do they know? I mean, you mentioned talking to your primary doctor. How do you know that it's, other than that avenue, can you do research online and other aspects too? Or is it's vital, I guess? Because you said you've traveled all over and have seen some of the best and in some cases some of the worst.
Yeah, and part of this process is what we call informed consent. So anyone receiving a stem cell injection or any surgical procedure or minimally invasive procedure for that matter has to go through a pretty informed consent process. What does that mean? That means that if someone is going to do a procedure on a patient, that patient has to understand what they're getting, why they're getting it, alternative treatments, risk and benefits to that procedure or that treatment. So it's really supposed to be the provider who's doing that procedure that should go through that informed consent process with that patient. That's critical. Unfortunately, I haven't seen that informed consent process always carried out, especially, and not necessarily here locally, but as I traveled around the country and heard stories about patients who were getting injections and had no idea what they were receiving, risk, benefits, alternatives. None of that was really discussed. So that process should occur before any procedure. And if you're unfamiliar with that process, that's where you can talk to your physician or your treating physician, and they'll walk that through you with that process. That's
obviously vital, truly.
And part of it is understanding when you go to and you hear about stem cell procedures is you got to ask questions, right? And if the answer is this is the way it is, and take my word for it, that's not good enough. Until the evidence is strong enough, there's really a responsibility of the patient to understand what they're doing too. That doesn't mean you have to understand the scientific language behind the types of cells and the processing, all that kind of stuff. But you need to know enough to keep yourself out of trouble and keep yourself safe. And that's why that relationship with your physician is so critical. Mm-hmm. That trust relationship is really critical, so that you know within reason what the risks are you're undertaking, and not just the risk, but what are the alternatives. For instance, If you have knee pain, has surgery been discussed? That's a viable option that's been proven. Different types of minimally invasive injections should be discussed as well, not just stem cells.
Let's talk about that for a minute. You have a patient come in and they really could use either surgery or, less invasive procedures, injections, and where did the lines cross? I guess what I'm trying to ask is, how do you get to the point where stem cell is really the way to go?
Yeah, that's a great question. And I think the process of evaluating whether someone's a candidate for stem cell therapy can be a little bit lengthy, right? So part of it is in getting the right diagnosis. So someone comes to my office and they say, I have knee pain, right? Well, why do you have knee pain? Do you have knee pain because it's general osteoarthritis? Do you have a meniscal tear? Do you have a ligament injury such as an ACL or PCL tear? So part of it is making sure you can actually diagnose appropriately what the problem is. That's step number one. Because if you don't have a right diagnosis, then there's no way the therapy, it's just random luck if it works. So that's important. So anyone receiving therapy should have a full physical exam. They should review imaging studies, whether it's X-ray or MRI, and sometimes MRI can be appropriate. So once you have the appropriate diagnosis, then it's important to discuss all treatment options for the patient. So in the instance of knee pain, sometimes a basic cortisone shot can be enough, right? Single, they have a little inflammation, the cartilage looks good, knee looks good, they can do a cortisone shot. Sometimes that's all they need. So there are certain jellies or what we call hyaluronic acid products that can also be helpful for treating knee pain. These are all covered by insurance, and there's some evidence that they're effective. And then obviously surgery. Total knee replacement is something we've been doing for a long time. And ligament repair, such as ACL repair, MCL, LCL repair, are treatments that have been proven to be effective. So it's important that those discussions occur and a patient is aware of all the discussions. Now, a lot of times patients either are uncomfortable with surgery, they don't want surgery, or they've done a lot of reading about stem cell and they see the potential and the benefit, and they want to explore that option. And we do that, and we discuss the pros and cons of all different types of stem cell procedures and what the evidence is, which is also important. And we have a lengthy discussion about risk and benefits. So there are different risk and benefits to each type of stem cell therapy, including bone marrow, adipose, and the umbilical and tissue products. So that's part of the process. So it takes a while. It takes sometimes diagnosing and getting the appropriate imaging, and then really approaching the problem that they have first from a diagnostic standpoint, so you understand what the problem is, and then discussing all the treatment options that are available, which is equally important.
Is stem cell procedure, if a person is trying to decide between having their knee replaced or stem cell, how do they make that kind of decision? Is it based upon whether the insurance company covers it, or is it, if money's no object, would it be better for that? I'm talking a general question about something very specific.
No,
I realize that.
That's a great question. How does a patient make the decision about what's best for them? Well, part of that comes down to the informed consent process, right? So, for instance, take the instance of knee pain, and it's determined that they have osteoarthritis. They're wearing out their joint. Probably the best study we have available for treating knees, and there's several small studies, but one of the best that I've seen was performed in a study of a case series of 40 patients from France. And there's a physician there called Dr. Hernago, who's an orthopedic surgeon. Well, he had patients in their 80s, and he was wondering what works better, total knee replacement or a bone marrow stem cell procedure. So he did a study. They had 40 patients. Both knees were bad. Half the knees he did with a total knee replacement, and then the same patient, the other knee, he did with a bone marrow aspirate procedure. And he watched those patients for anywhere from 5 to 15 years. And he looked at them. How'd they do? What was their pain? What was their functional improvement? Over time, how did those patients do? And then he looked at complication rates. And he looked at pain control and functional improvement. Well, it was very interesting what he found out. Of the 40 patients that had total knees, 3 of them had moderate to severe complications. One had a pulmonary embolus, one had a heart attack, and the other one had a stroke, of those 3 patients. Interestingly enough, in the total knees, about 30% of those patients required a blood transfusion.
30 of them.
30 of them
of the
did.
40.
And 3 of those patients required additional surgery. So they had to go back and do a second surgery to try to correct problems that arose with the first surgery. There were no blood transfusions on the stem cell patient procedure side. The pain control functional improvement was similar between both groups, and there were no major complications from the stem cell bone marrow aspirate procedure. Say, okay, well, why does that matter? Well, interestingly enough about those patients, when they asked them at the end, which would you do? Would you do a total knee replacement, or would you do a bone marrow aspirate procedure? Which would you do again first, if you had the choice? 28 of those 40 patients said they would try the bone marrow aspirate stem cell procedure before they had a total knee. Now, there could be a couple reasons for that. One is that the bone marrow procedure worked really well, or two, that the total knee replacement surgery was more difficult than they had thought. Now, again, this is a small study. We're talking about 40 patients. It's nothing to change care, but that's interesting.
That's almost 75%.
Yeah, it's very interesting. So what we try to do is educate patients about treatment options. Mm-hmm. And I try not to push them in any one direction. I try to say, look, this is the evidence, the best evidence we have. This isn't a randomized double-blind controlled trial with 500 patients, but it's something that's worthwhile. And patients who want to consider that and understand the risks and feel like they understand all the treatment options, many opt for that. I mean, I can speak from personal experience that I've injected my own knee with stem cell, a tissue allograft umbilical product. And so, from firsthand experience, what that decision is like. Thinking about risks when you are having that procedure yourself, you think about those risks. Well, what are the risks of infectious disease from the child or from the mother, right? You think about that. How well is that product being tested, right? Is the medical director who's looking at those surveys from the mother, the medical surveys, are they sleep when they're going through my batch, right? Are they paying attention? So you think about those things when you're on the patient side. And as a physician side, we also think about those things. The last thing we want to have...
So you're both on the same page.
We're on the same page.
Thinking about what's best for the patient.
And it's important, I think, to understand that this is part of the frontier of medicine. Mm-hmm. When you're ever on investigating a new therapy, the stronger the evidence, the stronger the recommendations can be. Now with stem cells, it's critical. And again, I say this, and I can't reemphasize this enough, is it's important to have informed consent and understand what you're doing. It shouldn't be a pressurized situation where someone's saying, well, we're going to get a dramatic discount if you go down and do it today. That's inappropriate in this space. The evidence is not strong enough for that, and it really has no place. I'll be perfectly honest with you. When I hear those kinds of things, I get very frustrated because it's important that patients understand what they're doing, and it's not a pressurized situation, because it takes some time to understand risks and benefits and alternatives. And that's true for any medical therapy, not just stem cell therapy.
Yeah. So, in your practice with the doctors that you work with at Southwest Spine and Pain, what percentage would you say? I shouldn't even ask this question, but I am curious about it.
Sure.
Of the stem cells procedures that you've done, would you say most of them are knee? Or, I mean, what are other areas? Because I think the listeners would really enjoy hearing that, too, as far as what other aspects do you do there besides the knee?
Yeah, what we try to do at Southwest Spine and Pain is we look for evidence that exists. So we're looking for some evidence, right? Mm-hmm. Mostly for safety, so we know that it's safe, and two, effectiveness. So what we're doing at Southwest Spine and Pain is mostly joints, so anywhere from shoulders, knees, hips. We're looking at rotator cuff. There's some evidence coming out. Spine, disc, as well as facet joint pain. We're looking at stem cells for those. And we have seen success with multiple procedures with multiple patients. And then we look at all types. And we're doing comparative studies between all types of stem cell procedures, not just bone marrow, but the others as well. We think it's important to be able to educate patients. When someone comes in, they say, how have your patients done? Well, I try to give them an understanding of, okay, this is who we treated, this is the percentage of relief that they've documented, and this is how many patients we've seen get better.
Oh, that's wonderful. Well, I appreciate, Dr. Rick O'Bray, what you've shared with us today about stem cell therapy. Is there anything else that you'd like to mention in the last couple of minutes that we have that might be of interest to the listener?
No, I'd probably say caution.
Okay.
So that would be something I would want to emphasize for my patients and potential people considering this therapy. Use caution. It's important that you understand what you're getting into and you have informed consent. You understand the benefits, risks, as well as alternative therapies. And that's probably the biggest thing. Do your research. Find out as much as you can. So when you ask questions, you can ask appropriate questions. And then involve your physicians. Involve your primary care doctors. Get their opinion. Like, everyone's opinion in this is important as we learn and the evidence gets stronger.
Thank you so much for being with us here today, Dr. Rick O'Bray. We really appreciate that. You've been listening to Southwest Spine and Pain Back to Life show. If you or your loved one is suffering from pain and want to know more about stem cell therapy, call Southwest Spine and Pain at 435-656-2424. Thanks for joining us. Tune in each Monday evening, 5:30 for Southwest Spine and Pain Back to Life show. Thank you.
Join us for Back to Life every Monday at 5:30 p.m. here on St. George News Radio, where board-certified physicians from Southwest Spine and Pain discuss different alternatives to live life again pain-free. For more information, go to southwestspineandpain.com.